Hi, my name is Dr. Szaro, and I'm the head chiropractor here at Physiologic. Today we're going to be discussing one of the most common elbow injuries that we see with our patients, commonly called tennis elbow. So tennis elbow is more appropriately termed lateral epicondylitis or lateral epicondylopathy. Generally, patients will feel pain on the outer portion of their elbow up near the bone, where most of the forearm muscles do attach. Now, most people would consider racket sports like tennis or racquetball to be the cause of tennis elbow, but more commonly in the real world, a lot of people get tennis elbow just from repetitive stress activities such as typing or turning a screwdriver or any repetitive injury that's going to cause stress at the elbow or the insertion of the muscles on the tendon that attaches to the elbow. So in order to discuss a proper treatment plan for tennis elbow, we're going to have to discuss the anatomy of the elbow. So your forearm muscles, there are multiple forearm muscles. 4 of them in specific will come and attach to what's called your common extensor tendon, which attaches onto the elbow. These muscles will generally flex the wrist up and down and also assist with flexion and extension of the elbow. With this injury, it is an inflammation or irritation to the common extensor tendon and those particular muscles that attach to it, which is caused by the repetitive stress we discussed before. So most commonly, the tennis elbow that I see is caused by repetitive stress, not by a frank injury from a tennis match or a racquetball match or something along those lines. So there are a number of treatments that you can use when trying to treat a lateral epicondylopathy. For the purposes of this video, we're going to be discussing 2 treatments. One of them is FAKTR. FAKTR is the acronym. That stands for Functional and Kinetic Treatment with Rehabilitation. And the other is Kinesio Taping, which is shown to be effective in supporting the patient in between visits, in between sessions. So generally, FAKTR works in 2 parts. The first part being some sort of sports massage technique. We use what's called a FAKTR instrument or a FAKTR tool, instrument-assisted soft tissue mobilization, to be specific. The tool working on the tendon will help to increase blood flow to the area, break down scar tissue, and generally help repair the tissue. The importance of bringing in blood flow is to help stimulate the production of collagen and fibrin, things that are going to heal the area or help begin to heal the area. So you're really just assisting the body in what it naturally can do. The second part of FAKTR is to rehabilitate or exercise the injured tissue. In order to get the area to heal properly, you want to realign those collagen fibers properly. So what the exercise portion of this is going to do, it's going to reinforce the soft tissue treatment. It's going to strengthen and heal that tendon long term. For today, we have a volunteer elbow. This is Nikki, one of our rehabilitation technicians. Today I'm going to be demonstrating the FAKTR treatment on her elbow to demonstrate for lateral epicondylopathy treatment. So the first thing that we do is we use a little bit of massage cream or an emollient, apply it to the area. And before, you saw some of the anatomy where the muscles came up and attached to the elbow. This is generally the area of high stress. This is where you're going to have most of the injury. So what we're doing is we're stripping out the area. We're trying to break down scar tissue. We're trying to bring in some blood flow. And again, the blood flow is to help start to stimulate some healing in the area. Now, the difference between just general soft tissue massage or instrument-assisted soft tissue mobilization and FAKTR is in most cases with FAKTR, we're going to add in some motion. So for this treatment, we're going to continue by utilizing an exercise called the Tyler twist. For this, we use a TheraBand flex bar. So the flex bar is going to assist in flexing and extending the forearm muscles and the common extensor tendon under a specific load. Now, the exercise was developed as actually one of the only research-based exercises to treat tennis elbow. And what we're going to do is, if Nikki can demonstrate the exercise, she's going to load the flex bar and then take out the slack with the injured elbow or the injured forearm and wrist. So what that's doing is it's actually lengthening this tendon and strengthening it at the same time. That's why the exercise is so effective. So while she's actually doing this motion, we're putting that tissue under stress. We're actually going to start doing our tissue mobilization while she's actually doing the exercise. And you can tell the difference when you're just going over the area statically versus when you actually add the motion in, you can tell a huge difference on how you can get into the tissue and how you can stimulate blood flow to that area, and the patients can tell you basically right away. So after we finish all of that, we're going to work on something called kinesio taping, which is going to take some of the stress and tension off of the common extensor tendon, which we'll get into next. So here we have an eye strip of kinesio tape. Kinesio tape can be used for a number of different reasons. It can be used to just generally take pressure off an injured tissue. You can use it for lymphatic drainage or swelling. You can use it for helping a muscle contract or relax. In this case, we're going to be doing it to take some pressure off the common extensor tendon, make the tissue a little bit happier, and then also taking a little bit of tension off of the common common extensor muscles, so the extensor compartment of her elbow. So this is generally something that you're going to leave on in between treatments. It is like having a treatment when you're not in the office. Besides doing the home exercises, it's a good neurological stimulation to the tissues and a way for the area to heal better in between treatments. So generally, we're going to apply this right at the top of the elbow, right above the common extensor tendon. I'm going to have her flex her elbow and her wrist up. And then as she extends her elbow out, so start extending your elbow out, keep going, you're going to start also extending your wrist down. So as you're doing that, you're taking the tension out of the extensor compartment, and you're basically allowing the tape to do its job at that point. So the tape already has a stretch in it, and when you stretch it a little bit more, when she releases the elbow, she's going to feel like it just generally just lightly pulls away from that area. So she could probably feel that right away. And this is something she would leave on in between treatments. So in order to rehabilitate the area, we're going to go through the Tyler twist one more time. It's, again, one of the most effective exercises for this condition. So if Nikki can demonstrate one more time, she's going to start an extension of the elbow, extension of the wrist and flexion of the elbow. And when she extends her elbow, she's going to slowly flex her wrist down, lengthening that tendon, lengthening the common extensor muscles, and strengthening the tissue at the same time. So if you're doing this repetitively, it's just like when you repetitively put too much stress on the area doing relative everyday tasks. This is going to reverse that. So basically, we're trying to strengthen that tendon and lengthen it at the same time. So if you've been suffering from elbow pain and any of these things that we've been discussing sound familiar to you, please call our office to schedule, evaluated by one of our doctors. I'm Dr. Szaro, and thank you for watching.